And Samar, you are now the host.
Yes, hello.
Hi, Alexandre. How are you?
Fine, thank you very much. Thank you.
Thank you very much for joining finally.
Your pleasure.
Munir, I'm still not the host though.
Yes, you are the host now.
Oh, now I am. Okay, awesome. All right.
Exactly. How are you, Alexandre? How is the weather like in Saudi Arabia?
I'm in Geneva, my friend.
You're in Geneva now.
Yeah, exactly. I came in Europe like 1 month ago because it's more easy to move around. I have many clients and many people to see between France, Germany, Italy, Switzerland. So instead of going out with now with all these tests, you have to go at the airport, make your test 70 hours and fly and blah blah blah. I decided at least to come to Europe for 1 month, 2 months. I'm sitting in Geneva, and from there. It's much more easy, really.
Okay, great. So thank you everyone for joining at BizzMatcher Accelerator Conference Day 1. I'm very pleased to see all those familiar faces with us today. So for those who don't know me, I'm going to make a quick introduction about myself. My name is Munir Bermani. I'm the CEO and founder of Signature Network, a platform dedicated to high net worth networking events, webinars, matchmaking events. And today we are so happy to host a couple of enthusiast startups which are going to pitch their business idea in front of some international investors and experts of the startup industry. So with us, we have some guest of honors. I'm really pleased to have with us Leila Derez, the project director of the Dubai Chamber of Commerce and Industry. Hi, Leila. It's a pleasure having you. We have Mohammed Bali, the CEO and founder of Peñapil Middle East. Hi, Mohammed.
Hi, Munir.
We have our moderator, Samar Hassan, live from Pakistan.
Hello,
Samar.
Everybody.
Hi. So Samar will be very kindly, allow people in as more and more people are joining in now. So this is the first day. This is the day 1 dedicated to health tech, education tech. So we're going to start first by a quick introduction of Peñapil Middle East and their humanitarian action in the world before we can move on to Leila Derez for a small brief pitch about her initiatives and the Chamber's initiative and how to give motivation to the startups who are pitching. Mohammed?
Thank you, Munir.
Stage is yours. Yes, we can hear you.
Thanks. Thank you, and good afternoon or good morning, everyone. Wherever you are. I'm the CEO of, my name is Mohammed Bali, I'm CEO of Peñapil. Thank you, Munir, for this introduction and for making Peñapil Middle East your charity of choice. It gives great pleasure to speak today, and I wish all the best to all the startups who are pitching today. I will not take too much of your time, just briefly introduce who is Peñapil. Peñapil is a UK-based organization, and we were established in 2009. And currently, we are present in US, Canada, Australia, South Africa, and of course, Dubai. We operate in over 35 countries in Africa and Asia, including the Middle East and as well as Latin America. In addition to responding to disasters and emergencies, we also support long-term projects. In this, we help communities for sustainable development in agriculture or income generation, and in a number of sectors. We always strive to provide support to local organizations, this to help them build their capacity and become agents of change themselves. As you can imagine, the last few weeks and few months has been really focused on a number of emergencies. Main one was, of course, the explosion in Lebanon, where we dispatched the team, the emergency team. They provided food, non-food items such as hygiene kits. We also helped impacted families to rebuild their homes or to fix their homes. And we are still on the ground supporting them with food as well as hygiene kits in these uncertain times, coinciding with the economic crisis in Lebanon as well as the corona. this has really impacted in a massive way on people's lives. We are also more recently, we have been active in Pakistan responding to flood. And it's an ongoing work that it's a non-stop in terms of responding to emergencies. We had great support, great response from our supporters, and I hope to expand our activities. And with that, just wish you all the best. And once again, thank you, Munir, for including us and for making us your charity of choice. And
thank you very much.
Yeah, thank you to Yalla Give, who are also our supporters and part of our support in our work in UAE. Thank you. All the best.
Very much indeed. Thank you very much, Mohammed Bali, CEO and founder of Pineapple Middle East. I'd like to move on to Miss Leila Dres, if you don't mind. Leila, the stage is yours.
Assalamu alaikum. Welcome, ladies and gentlemen. It's an absolute pleasure to be with you this afternoon, representing Dubai Chamber of Commerce and Industry. We've been working with Munir now for some time and been part of his other initiatives, and hence we're here today, this afternoon. Dubai Chamber of Commerce, as we know, our job or our responsibility is to support and represent the business community here in Dubai, as well as those globally who have an interest in doing business with the Emirates. Considering this is specifically for startups, Dubai Chamber of Commerce has the Dubai Startup Hub initiative. And our remit under Dubai Startup Hub is to support startups here in Dubai or those wishing to enter into this foray. Our responsibility is to work with entities and companies such as Munir to build this ecosystem, solidify this ecosystem. And we're on call at any time for any of the startups that are joining this fantastic initiative over the next 3 days to reach out to me through LinkedIn or through my direct contacts or through my brother Munir here. And I'd be more than happy to pass on the details, your details, to our Dubai Startup Hub team to see if there's any way that they can support you guys. Again, thank you very much for having me, and I look forward to hearing what we're going to hear today in the next couple of days. Thank you, Munir.
Thank you very much, Leila, from Dubai Chamber of Commerce in Dubai. Before we move on, I believe we have Mr. Abdullah Noemi with us, right, Samar?
Yes, we do.
Yes, Abdullah, can you hear us? Thank you very much for joining, Mr. Abdullah. It's always a pleasure to have you. Yes. I can't hear you loud and clear. Can you say something, Abdullah? Hello?
I can't hear you, Munir.
Yes. Can you hear me better now? I'm going to improve the sound. I can't hear you at all. There is no sound from your side. Samar, can you hear me? Is the sound okay from my side?
Yes. The sound is okay from your side, but we can't hear Abdullah. So Abdullah, do you want to exit and come back in again? That may help.
Is Abdullah still around?
I think he is not even hearing us.
Yes. Okay.
I am just messaging him.
Yes, sure. For the time being, we have one of our investors with us, Alexandre Katranki. Alexandre, it's a pleasure to have you.
Yes, please. Hello, nice to meet you. Same.
Yeah, Alexandre, would you mind making a small introduction about yourself and your business and your actions in the region?
Okay, so basically we are established between Saudi Arabia and Bahrain for the last 21 years. We have founded our own investment fund and capital raising firm. So how do we act when there is a startup, a project, seed, pre-seed, Series A, Series B, or whatever? Either we invest ourselves, our own portfolio money from our company. Either if we are not interested, but we see that there is a potential or something, then we raise the file to our investors, which can be a high net worth individual from the Gulf, VCs from the US, family office from Europe, Switzerland, France, or UK, to raise the necessary capital for the company.
Okay.
That's basically what we do. We have a long track record coming from SMEs boutique to Fortune 500 companies.
Excellent, excellent. Thank you very much,
Thank
Alexandre Katrangi, live from Geneva, if I'm not mistaken this time.
Now, yes, definitely. If you have called me 3 weeks ago, I would be in Bahrain. You know.
Okay, let's move on to a quick introduction from Mike Hardcastle. Mike, would love you to, like, live from Oxfordshire. Would love to see you make an introduction to our audience and our startups about who you are.
Okay, well, my name's Mike Hardcastle. I'm an electronics engineer by profession, but got into computers and then discovered the internet in the late 80s, campaigned to allow commercial traffic on the internet. That went through in the UK. So we were one of the first countries to allow commercial traffic on a non-commercial internet. I joined my family's public company at quite a young age, which was a global electronics company, and then refocused it as a .com, which massively inflated the share use in the crash. So we were ripe for takeover. That happened in 2002, 2003, where we exited. We started buying all the divisions of our former public company and floated those, had quite a lot of success with that. Finished in 2012. So since then, I've been involved in investing in the tech space, primarily in a place in London called Tech City, which is attempting to emulate Silicon Valley, and had a fair degree of success, actually. We've Tech City is really coming along and is one of the main hubs around the world. And yeah, I invest primarily in technology itself. So rather than the application of technology, I enjoy the core technology itself. And I'm really looking at my next phase is really investing in technology that will evolve humanity into the next form of evolution. So I'm looking at Darwinism in terms of evolution. To that extent, we invest in a specific Internet of Things technology called LoRa, which is really building a global planet-wide sensory network to connect to the brain that is the internet. And that's my main focus at the moment. And then all the other things that connect into that. So obviously, healthcare, education, everything that can connect into a global sensor network that is connected to the brain that is the internet. That's where I'm coming from.
Thank you very much, Mike Hardcastle, live from the Oxfordshire in UK. I believe we have Abdullah is back with us now.
Yes.
Mr. Abdullah Noemi. Please, Abdullah, the stage is
hear me now?
yours. Yes, we can hear you
we can hear you.
perfectly.
Excellent, excellent. Salam alaikum. Good afternoon, everyone. Thank you very much, Signature Network, for inviting me today. Munir and the team, congratulations for putting together this wonderful event. Once again, I'm delighted to be with you today. I'm legal professional. I have a fundraising and legal background, and I represent a company called Namus Legal Services. And I had the privilege to be invited by Munir, who has been a great friend, to attend this wonderful event today. I'm very excited to be with you and listen to the startups pitching to investors. I'm very looking forward to that, and I wish the best of luck to all the startups that are participating in today's event. For me, I just want to give one simple advice to all the startups from the legal perspective. Make sure you have a clean structure if you're pitching for investors, because that is going to be very crucial in the next stage after you secure the interest of investors. And that's it for me. I wish you good luck and looking forward to your pitches. Thank you very much, Signature Network and Munir.
Thank you very much, Abdullah and Noemi, CEO and representing Namus Legal Services. Back to you, Samar. I'm going to introduce Samar, our moderator for the entire session from Monday to Thursday. Samar Hassan, live from Pakistan. Are you here, Samar?
Yes, I'm here. Hello.
Yes, sure.
In case people cannot see me, I'm Samar. So
Yes.
welcome to BizzMatcher. And I can't tell you how excited I am, because this is startups is what I breathe, eat and drink literally for the past 3+ years, based out of Pakistan. So I run an impact enterprise which focuses on catalyzing impact entrepreneurship in Pakistan, and now hopefully in emerging economies as well. So what I do want to kind of quickly reiterate, I know you guys have already read the code of conduct guidelines, but just to reiterate, when we're not speaking, when somebody else is speaking, we have to stay mute. There are only certain people who can ask questions. Everybody has been assigned, all the startups have been assigned a certain time frame to complete their pitches. If you go, unfortunately, okay, so I'm going to be a dragon. If you go over time, I have the power. Okay, the power is all mine. So I can actually mute you guys, which is going to be very disappointing for all of us. But so try and wrap up your pitches in time. Other than that, of course, because we are all coming from different backgrounds, different religious, ethnic, different orientations, etc. So we just have to be mindful to be kind to one another and not say anything that we wouldn't like just to hear being said to us. So that's about it. Have I missed anything? Oh, yes, very important. So, refrain from contacting one another directly, because that is what Signature Network is for. And they've put together this excellent event for everyone. So that's again something that we would request you to respect. All right.
Yes, all right, Samar. We have been joined recently by Hanan Ben Khalok. So I just want to say hi to Hanan, one of our advisors, one of our illustrious advisors. It's a pleasure to see you finally. Hi to Heike and to all the beautiful names which I cannot see in the list because it keeps growing on and on. So without any further delay, I would like to let's introduce Samar, our first startup, the first pitch from Sakina, represented by the company, represented by Mohammed Naeem.
And Azam.
And
so we have two people, yes.
Sure.
So we have two people today from Team Sakina. So they're going to be the first ones to pitch today. So best of luck, Naeem and Azam. You have a total of 8 minutes, I believe. So in terms of time, very quickly, some people have been allotted less time, others have been allotted slightly more time. That is simply because their startups may be a little more complex and they deserve a little more time to explain it properly. All right, so Azam and Naeem, over to you guys.
The stage
That's
is
great.
yours.
Thank you very much. I'll just start by sharing my screen to you guys. Great, you should be able to see the screen now.
Yes.
Yes.
Excellent, thank you very much. And of course, it's a pleasure to meet you all on this afternoon. I'm Azam Sheikh, co-founder of Sakina, the mindfulness and meditation app created specifically for a Muslim audience. We're incubated at In5 Media in Dubai and the University of Bradford, UK. Now, according to the World Health Organization, on average, every week, 1 in 4 adults experiences a common mental health problem, and 1 in 5 adults has considered taking their own life. As there are approximately 1.9 billion Muslims in the world, the above 25% would equate to 475 million Muslims globally affected. Now, Sakina started as mindfulness and a meditation app for Muslims, but has a far greater vision. Firstly, it is a guided mindfulness and meditation series on different topics by marrying modern science and religion, created by qualified psychologists, scholars, and experts. It intends to provide support groups to those going through a certain phase in their life, and also offer access to audience to qualified experts through video and audio call for one-on-one group sessions. Now, Sakina is already live in beta for iOS and Android. The technology built is using Reactive Native. Smartphone penetration is on the increase year on year. Smartphone penetrations are yet to explode in emerging markets. This chart is just a sampling of the data collected for approximately 70 countries. With our conservative estimates, we would be able to target 437 million Muslim smartphone users, and of those, 109 million with mental health issues. Now, once you log into the actual dashboard, a user can go through the categories and select from an album that connects with a mental or emotional challenge they are facing. Now, diving into a playlist will have content present over a 5-day, 7-day, or 10-day period. Our aspiration is that either at the end of one series or several series, the listeners achieve not just a sense of relief or calmness, but actionable solutions to deal with what they are facing. Sakina has an extensive process for content research and production, not only on the topic selection, but also the qualified scholars, life coaches, and mindful teachers. At any one given time, we could be working with 5 experts. We have 12 categories. Within those, there are 34 albums. Those albums expand into over 170 playlists. There are a series of 5, 7, 10 days, and over 50 hours of listening time. So here's a bit of a snapshot of what we have achieved to date. 12,000 downloads with 65% active users and over 350 paid users. Those users who take up the free trial, 7 out of 10 convert into a paid subscriber, and subscription retention is around 65%. Over the next 5 years, we'll expand, adding 3 more languages by mid-2022 by becoming multilingual, online support groups, one-to-one sessions, expansion to Muslim teens and young adults, and finally, a package allowing families to face their struggles as a unit. Now, Sakina, niche landscape, Headspace and Calm are by far the biggest players in this landscape. Now, Sakina's competitive advantage is that it is able to target an underserved audience who are deeply rooted in faith-based content, but yet to be provided a solution that marries religion and modern sciences to tackle mental health issues. But I must stress that Sakina, although has its foundation rooted to Islam, it is not closed and open to all to access. In fact, we already have non-Muslims using the app. Now, Muslims prefer guided content that is in line with their own faith. Competitors have a significant alignment with Zen or Buddhism practices. Content in light of the Quran, Hadith, and Islamic literature can be represented in any native language of a Muslim, so it transcends territorial boundaries. Now, we aim to achieve institutional backing from NHS and other public and private health sector institutions. Sakina has been included into an incubator for the University of Bradford. We have started conversation with the faculty towards providing Sakina as an alternative to patients undergoing counseling or mental health support. So that for us is a step in the right direction. So we captured an audience early on with organic traffic. Alongside organic traffic, we are now focusing on paid digital advertising and social media influencers. A small experiment with 2 influencers at an approximate cost of $100 achieved 308 downloads. We've had conversations with media outlets, blogs, websites that target Muslims and intend to either engage in paid advertising or bring them on board as affiliates. PR has seen us mentioned in the likes of Forbes and the National UAE. Our team is myself, digital marketing specialist, 23 years of experience in digital. Mohammed Naeem, co-founder, more than 9 years of experience in digital and strategic marketing. Kashif Hamid, Chief Product Officer, strong background in UX and increasing revenue streams. Yusra Kandel, who has achieved over 350,000 followers with a content-driven strategy. Omar Ali, brand specialist, he's taken UK startups to national recognition. And right from the onset, a friend of mine, Shazad Yunus, founder of BizzMatcher, has been supporting us in an advisory role capacity. BizzMatcher, an iOS and Android app, has received over 8 million in funding and achieved 3 million downloads. With meditation app, consumer spends on the increase, and so therefore an opportunity has risen. Muslim consumer spend is expected to be more than 3 trillion by 2021. In the USA alone, Muslims reach more than 110 billion in disposable income annually. Right now, it's just the beginning for us. Currently, we are charging USD $4.99 a month, and we want to increase that to $6.99 as we grow. Based on user feedback, we are planning to revise and add new layer pricing. For instance, we have accumulated data on competitors, and 97% of the Calm subscriber base are either on a yearly or lifetime plan. Our tiered payment plan will include $60 for a yearly plan, so that's a generous 2 months for free. And we'll also explore lifetime and family packages at a later stage. Now, due to our own commitment and belief in Sakina, we've already invested 10% of the asking funds from our own funds. Further, none of the core team are paid. Therefore, our expertise and time has also been invested. Now we are asking for an investment of $700,000 towards achieving revenue of 54 million by the end of 2024. With the funds, we want to drive growth via marketing. And whilst our subscriber base grows, Sakina intends to provide hundreds of hours of content to those users. A proportion of that fund will sustain overall infrastructure, which could include paying staff, onboarding support team, paying for recording time at studios, etc. We have a target to initially achieve subscription at a cost of $8 and refine our conversion rate optimization to achieve CAC at $4 by 2024. So I thank you.
I'm sorry, your time was up. Was I too? You were just saying thank you anyway, right?
Yes, it was exactly a perfect timing.
All right. Okay, so questions?
Thank you very much. Azim, if you can stop sharing your screen and we'll allow the audience to ask real questions. I believe we have a question from Jean-Luc Scherer. And hi, Jean-Luc. Jean-Luc is one of our illustrious advisors.
Yeah, hi. Sorry if I joined a little bit late, but
it's fine.
No, it's a great app. I have some questions though around the business model. And basically, it seems that you're going for a freemium model. Because in the data you shared, you mentioned you have about 7,500 active users and 5% of these are paid subscribers. So, and then when I look at your growth plan, you look at 4,000 active users, paid subscribers by end of 2020. So that's, multiplying the more than 10 for the remaining 4 months. So in a sense, you have a very active or aggressive growth, but there's a doubt I have around the conversion into paid subscribers. What are you going to do to get more of the active users to turn into paid subscribers to kind of motivate that growth? That's my question around the business model.
Mohammed or Azim, can someone answer?
Apologies, I was speaking, but I was muted. So yes, that is an absolutely fantastic question, and obviously a very important one that is pertinent on our minds as well. So we've discussed several avenues to be able to do that. One of the things, of course, being email marketing. So that is engagement we're talking about, whether it's through notifications, whether it's through email marketing, whether it's actually opening up the doors for the free trial content that we give. At the moment, it's only restricted to one piece of content because we have been experimenting. So the interesting thing is we have all of these people who have downloaded, who are still active, but yet don't have access to a ballpark of the content. So imagine we're able to give them more access. The more they get engaged and the more they start to rely on our content as a daily requirement and a need, because we're finding that so many people are coming back. We're hoping that that hook and that sync will be there to attract them and get them to become paying subscribers.
That's exactly why I was asking the questions, because typically when you have a freemium model, it's not that straightforward to move over, even with good content. So I was wondering if what additional things you have to nudge them over to basically get them to become paid subscribers. So your main strategy is around content, right?
Our main strategy is around content. We've restricted the amount that they can have at the moment. We will increase that. We should increase that. We need to experiment with that. And that will be the foundation, I suppose, towards to get them to convert even more. This is our shortcoming at the moment, but nonetheless, even with the limitation of the content we've given them, they're still coming back. So imagine when we're able to engage them more than we are doing now, what kind of impact that will have on them to want to go for the full model. And of course, the 2-month free by paying for a yearly, that was new information that came from us very recently about Calm strategy. So we're thinking, as soon as we're able to introduce that model, perhaps that's another incentive for them to say, right, I'm signing up for the 12 months because I'm going to get 2 months free. I hope that helps.
Yeah, sorry. So besides that, hi everyone. My name is Mohammed. I'm the co-founder along with Azam. So let me add, besides what Azam has explained, another things that we are planning to do is as well get endorsement from scholars and Islamic authorities and bodies. So that would also add up to our growth rate.
Okay, Mohammed. Thank you very much for your contribution. Samara, do we have any other questions from the advisors or the investors in our?
Yes, please.
I think Alexandre wants to ask something.
Alexandre.
Yeah, please. I have a couple of questions, very short bullet point question with bullet point answers. First of all, can you just highlight in very few words how the operation mode works, with your app? I mean, the spirit of the business. Okay, I'm depressed, I want to suicide myself. Then what I do with your app?
Yeah, so essentially you can go in and you can select albums that are based on your emotional, mental state that you're feeling. So we do have content that targets depression, despair, fear, abuse. We've got a trauma set that's just in the production stage for recording. So if you've had a traumatic experience as a child, for example, you can go and select that and listen to that that'll be over a 7-day period. And we've done that specifically because we don't want to overburden anybody with masses of content. They can choose to listen to all in one go, but we want it to be digestible, bite-sized, 5-day, 7-day, 10-day listening with the aspiration that at the end of it, they've received a sense of calmness or relief or some kind of way to be able to deal better with the challenge they face.
Okay, clear enough. My second question, I looked at your slide in the next stage deployment international. And of course, I understand that it's an application which will be more oriented to the Muslim world, but at the same time, would you consider to, instead of going into the Muslim world, going through more West Europe and the US? I tell you why, because the volume of Muslims in Europe and in the US is less than the Muslim world, but the power spending and the power purchase is much more higher. While at the same time, in the Arab world, people benefit from, let's say, the social environment, the family environment when they are depressed. While in Europe, the migrants and the immigrants or the Muslims from the second or third generation, they feel more lonely and isolated than when they are in the Arab world.
That's a fantastic observation. Very good. Yes, so most of our activities have been either in the USA, UK, or Canada, and some Europe. Even the Facebook advertising that we've done, we've only targeted those countries. And we have done some experimentation in other areas through Google AdWords, but predominant focus is on these developed countries. And we will keep on spearheading that, and then we want to, from there, transition to other countries as well, hopefully aiming to find that balance between subsidizing between what we get from Western countries and what we get from non-Western countries. We don't, although yes, we have a financial model, absolutely, but we want the app to be able to obviously benefit as many people as possible in those situations. So sure, the buying power may be less in other areas, but nonetheless, we'd like them to be able to access our app and benefit it. So that we are trying to marry that balance, but we have seen an interest and an eagerness in these other developing countries to want to use the app and even pay for the app.
Okay, and my last question, as far as your application, touch the psychologist, psychoanalyst, whatever, in this field, did you make an assessment that in some countries you don't need any sort of license, from like Ministry of Health or licensing or something?
Correct. If we were to become actual counselors, which would be part of maybe our next stage of the support group one-to-one, there is some basic qualifications that are required. In the UK, a level 3 in counseling would be sufficient for that. You don't need a PhD or qualified through university. That would be sufficient for you to have a license.
No, I don't talk about the individual. I talk about the company, the application itself.
No.
To be able to operate, you will not be requested to be granted a license or something from.
No, not unless there was a medical prescription involved, but otherwise, no.
Okay.
No, I'll give an example of UK, University of Bradford, where we have got incubated. The University of Bradford has one of the largest dementia center. So what we have been asked actually is to keep in place certain regulations, some sort of contracts in place with the councils on these things, so that it's controlled, it's kind of legalized. But as long as license is required, there's no specific license which we have been asked to get.
Okay, clear. And my last questions regarding looking at your teaser, you're looking for 700,000 against how much equity?
16%.
16, 16?
16, correct.
Okay. Thank you.
Thank you.
Okay, thank you very much, Alexandre, for your questions. Salma, do you have any other questions for Sakina?
Well, none at the moment. Nobody's raised their hand or anything.
Heike, Avi, Mike? No one at the moment. Okay, fine. So let's chain up with the next startup. And I believe that startup has itself made a comment in the comment section saying you should have some objective questionnaire if you're not using them already, like MINI, M-I-N-I, for psychiatric disorders. All the best, Dr. Viviana. And that very doctor is the one who is going to pitch for her business. If you want to make a comment, please make a comment, Viviana, Dr. Viviana, and then...
To the point which Dr. Viviana mentioned, that's something in the next phase where we have app development and certain features coming in, there is going to be a questionnaire, more like a predefined question that you have to answer. It's more like a drop-down options where you will have to answer what's your age, what you've been through and what you're feeling last 5 days, 7 days, 8 days, and all these things. So there's a predefined set of questions that we're going to implement in next phase.
Great. If I can, they are great questionnaires. They're quite long and boring for the subject to complete. The MINI is one, and the other one you probably know is the NEO-PEER, the neuropsychiatric consultation. Anyway, it's just because they really gave a broader perspective also of the personality of the subject, which you might want to take into account. So if someone has an introvert personality, anyway, this is another topic for another day, but I'm just saying, look into it because that's what I do in my other job.
Oh, no, that's fantastic. We appreciate it. Maybe we'll pick your brain on that subject another time.
Yes, no problem.
Well, thank you very much. Look, normal circumstances, we would be able to clap for them in person. So well done, Azam and Naeem. Thank you very much. And, so now, obviously, Viviana, you've broken the ice already. So Viviana is coming on board for her startup, which is called Limbic Resonance. So Viviana, best of luck to you.
Thank you very
much.
much.
We know sorry, 1 second. So Munir, how much time does Viviana have?
Viviana has 7 minutes.
Okay, all right.
Okay, thank you very much. Thanks, Munir, for having me. Limbic Resonance. So I will introduce myself at the end, but as you got an impression, I work in the medical field, and I came up with this application also because I used to be an ex-professional athlete, and I'm also a sport nutritionist. So Limbic Resonance is really wants to be the first application and platform that operates in the field of wellness and sustainability. In today's world, one of the major problems that I see as a big pandemic, in my opinion, is obesity, especially living in a Western country. So we know that obesity, like in the US, is accounting for 210 billion to the healthcare system, is leading to a huge epidemic. We also see with COVID that if you have a morbid conditions like obesity, you are much more likely to have difficulties in dealing with this virus. So it's really a huge global issue. But what people don't understand about the food choices, and apart that there is so much psychology from what we saw in the previous startup, is also that your food habits do influence climate change. And just to give you a broad idea, 14.5% of the CO2 emissions coming from dairy and meat products are the equivalent of the same use of all the cars, trains, planes, and this is just from meat and dairy products. So really what you eat has a huge, huge power to influence and shape the future of our planet. And another thing that I came across lately that really came and it's close to my heart is the fact that so many people that try to engage in activity and sport, and they really don't have a clear understanding of what to eat. So combining all these issues that I found, we created Limbic Frequency. limbic resonance, which is basically providing the first customized certified spot-specific food options available for different restaurants. So in simple terms, we made an algorithm where the users can connect and they can insert and answer different type of questions, and as well as connect them to their fit watch and saturation, blood pressure, and if they have allergies or other metabolic problems. And we kind of tell them according and only differently from any other apps, according and specifically to the type of activity they're doing, what they should eat if they do weightlifting, if they do cardio, if they do yoga, and then it matches with the restaurants nearby. So we have a location base, and on the top of it, we offer an educational system so that if you are eating more vegetable and vegetarian food, you accumulate points through a carbon footprint card system, which will enable you to get discount on the app. This is our first idea, first, let's say, step. The second step is then to make the app and to build a community, which will become like a Tinder food for an app, where you can not just look over the restaurants, but also what type of people you can connect and share a meal with. So the value propositions and what we have is indeed the technology and the algorithm, the carbon footprint card, but really the unique point and the selling point is that we try to provide this educational content, which no one is really doing. And once we build the community, what we want to do and shift is moving into the second phase of our vision, which is to actually create an ecosystem of companies that operates within the wellness and sustainability field, where we can actually engage and provide strategic scientific knowledge and marketing. As you know, for us millennials, there's so many questions that and so many informations that you are exposed to, and sometimes people are really struggling to understand what to believe, especially in the field, as you can see now, in wellness and nutrition. So we have different revenue stream for the first phase, which is of course the download of the users. We also offer marketing for the restaurants at quite cheap fees. And then we also offer food and menu consultancy. And being in a phase like where restaurants are suffering from the crisis, shifting into an online community and delivery is probably the answer. And then we have a second phase that I'm not going to go into discussion. So despite we have many competitors operating in the delivering field, especially for food, no one has really tackled the sport-specific option so far. And I have done extensive research to really try to understand why this has not been done yet. But so far, they never combine the location and the tangibility of the using and knowledge about how you should eat with the surrounding environment of the users. So this is still, there is a gap in the market that which we can bridge. Our strategy is to start from Europe and then moving into the Middle East and eventually North America. We're also gonna have a strong branding coming from space, because I'm also an aerospace physiologist and I work at the moment in supporting moon missions. So we want to try to push the people to have this global understanding of how your actions can influence the planet. And then we relate it to sport, which in my opinion is probably the only thing that can really unite people on any level, any religious or anything. Sports unite us all. And the idea is to try to launch it before Tokyo 2021. So we have many different competitive advantages, and approaching the sport-related food and linking with useful option near the users. We use different parameters, and we provide educational content, which I think is the missing link for many people to understand the impact of their choices. I'm the CEO. We have a technical partner which has been also established for more than 10 years. They have been developing a number of different applications from Android to iOS. We also have which is Just Beat, they're based in Italy. We then have a digital project manager and also co-founder of digital applications. I have a colleague, which is a physiotherapist working with athletes of different kinds, especially footballers. And then we have a CFO, which is also a co-founder of Prime Partners, and we have advisor, a nutritionist that works currently with NASA, and we work together. And then we have a lawyer, which is currently working in the bike economy. So for investment, we are looking to raise 250K. We thought about giving 25.1% to the first 100K, and then to establish different milestones so that the injection will be done in the delivering of every milestones. And we have expected an investment return after 1.5 years. And yeah, so basically in a nutshell, this is what we aim to do. It's really to provide a useful and reliable, finally, app that can guide people in understanding not only benefiting their well-being, but also the planet well-being. Yeah, if you have more questions and you want to know more, please contact the signature. I'll be happy to discuss more in details, everything. Thank you.
Excellent. 7 minutes, 4 seconds. Okay, so sorry, Azam, I was rude. I just cut you off exactly at 8, even though you were saying thank you at that point in time. So with Viviana, I have learned. So thank you, Viviana. That was excellent. All right, questions.
Viviana, you rehearsed. I'm so proud of you. You rehearsed, you did your homework. So, sorry?
I'm sorry if it was very quick, but it's just to give an idea, you know, there's so much more to be discussed if anyone is interested.
Okay, so I think we have a question from Hamid, one of our investors, Hamid Alibeki, who is asking, what is the method of your valuation, Viviana?
Valuation for the parameter, the physical activity of the subject, so the algorithm, or valuation for the CO2 emissions and water impact of the food, which one? So for the first one, what is the validation for the market fit? Well, we are actually, now we just made the algorithm and a lot of extensive market research. So we haven't really tested the application yet. So I have not made the real tangible, we made a small market research also within, not too small, within different users. And so far, especially mostly in Europe, I must say, we got positive feedback of people that would engage and get this. This is really something. I got around 1,000 people that I used to have also 3 gyms and a personal training studio myself. And I got a lot of people that constantly been asking for guidance, especially related to the type of physical activity they do.
Okay, Heike, we have a question from Heike. Heike, I would love if you can support your question by adding some comments. So why is the focus on women first and not on men? Do you want to add something on top of your question, Heike?
No, I'm just surprised because obviously we know that men are very much looking into physics, and you know, I just wanted to understand, because in my experience you have equally like vegetarians and vegan people, or like health conscious people, you know, so I just didn't understand why the focus was primarily first on women. You know, why having this diversity rather than saying, okay, it's for both genders equally. So I just didn't understand.
We definitely would look into probably having a fluid and mixed gender, but if we have to strengthen this, we wanted to strengthen that was more made mainly for the women, because the idea is also to shifting in the second phase of creating an ecosystem where you can reuse through the carbon footprint card the points that you accumulate. And we know that women are the ones that actually buy more products for the house and serving the meals to families. And so shifting into the second phase, we were thinking this could be the way where more women are actually providing for the family. But in terms of the actual use of the first phase and application of, yeah, it probably should be equal genderly distributed.
But also in your proposal was that, you know, afterwards you want to go into choosing who you want to go to, like having a meal with. So. Yeah. Not including the man, you assume that the women want to go out for dinner with other women rather than having a mixed gender.
No, we are not just, no, I didn't put that we are not including the man. I didn't put that. We will include the man.
But then equally, the focus is on women. But then, you know, if you want to go into the second phase and you focus on the women, because if you then want to go into second phase and say, look, I want to also engage people meeting, which I think is a brilliant idea. But if you don't include the men for the beginning, then it's very, like the second phase could be a little bit more challenged, you know. So.
Great observation, but no, I didn't mention that. We will include the man, but thank you for the observations.
Okay, thank you, Heike.
Okay.
Yes, Jean-Luc.
Yeah, I have, so it's very interesting when you try to create a new market where basically you look at the intersection of health, fitness, well-being, and also sustainability. But the question is, do these markets actually intersect, and to what extent? And that is where I would have liked to hear a bit more about the validation part, because the guts feeling is that people have one or the other as priority, but not necessarily both, and maybe not necessarily at the same level. So how did you validate that, and did you manage to find a large enough early adopter segment that would basically be the trigger to create a new trend for that market that you're basically trying to create?
So the trend is actually quite big, and most of the people, so what we try to do with the app is to provide a functional benefit, an emotional benefit, and a social benefit. If you look into the sport people, I mean, sport people are often connected to nature in a sense that, there's so many outdoor sports, and the fact that you're already conscious of yourself, and this is more psychology based, but then you're conscious of your surrounding. And so the validation that we've done so far was an extended questionnaires where we got more than 1,000 answers. And the technology is not developed yet. I mean, we don't have the physical app to be validated, if that's the question. That's what we are trying to raise capital for. So we've done an extended questionnaires, and the idea of mixing the two is actually exactly the message. We are kind of tired of thinking human being as intersected, like, oh, we only focus on this and nothing else. Actually, we want to merge the two, because the real answer comes from that. Some people may engage in the app just because they are selfish, narcissist, and they want to look in the mirror and thinking, oh, I want to look good. That's fine. But by doing that, they will gain also information. And if they will adjust their nutritional point, they will also gain points to then reuse on the app or eventually on the ecosystem for this carbon footprint card. And so they will be motivated and pushed and learning by just osmosis, kind of, even without getting too much of the information. Other people on the other side may not be totally engaging in a physical activity, but they will still have the space of to heart the well-being of the planet, and that's where they might be able to then tackle. So we actually, I don't want to distinguish the two. I think the strength comes from uniting them and combining them.
All right, fair enough. And regarding the business model, I think you mentioned you have subscription, but then also you want to do marketing for the restaurants.
So what we have a subscription fees for the users that download. And the other idea was also that because we want to provide a type of different marketing to the restaurants that they join the app. So most of the restaurants at the beginning, when you go and you're not Uber Eats or you're not Deliveroo, why they would give it to you, right? So we have to give something back to them. So the idea is to provide them a consultancy on adjusting their menu according to what the type of sport-related food nutrition that some places like London, which is quite forward, they do. New York, they do. But if you go to Zurich or other places, actually they don't do in Switzerland, or in other countries like in Holland, they don't do that. So we want to try to provide, there is a huge trend about pre-workout, post-workout meals, but they're not really categorized on physical activity per se.
Right. But that is something you can do once you have enough data about the community in a certain area, right?
Yes, but yes and no. Yeah, it can be done regardless of, I mean, you mean in terms of feasibility?
No, the value. I mean, if I know that I live in a neighborhood where there's a lot of people interested in that type of menu, I'm more likely to change my menu. If you don't have that data, it's harder to convince me to pay for the consultancy.
Yeah. No, but we do have some data. So we made the first city was London. We find they have 1,500 restaurants, and we also estimate 15,000 restaurants, and they have around 1,700 gyms. Big brands, which we have estimated, and we try to already look into where these places could be. We also are in contact with some of the gym places because of my background and what I did before, like Aspri Arlois, which is a huge, one of the poshest branding of gym in Europe, and they have already restaurants in it, which could be an early adopters. So, I mean, we have the connection to launch this within the sport community. And the idea is also to get the big names, like big athletes, which we do have access that are going to be in the Olympic Games to promote the application.
Okay, so there are a couple more questions in the chat, which have been sent by Hamid. Is your app location-based for suggestions? Does it include all regions? And then Yvette is asking, how did you test the price point that users would be willing to pay?
Is your app location-based for suggestions? So far, we will have to focus on different cities, and we were thinking to start from some of the major cities in Europe. From the research we did, like London, Amsterdam, Zurich, not Italy. Italy is not going to be, I'm Italian, but Italy is out of the market and out of discussion because of the food difficulties we have here. People are too picky. And in terms, so these are the other regions then we would like to expand will be the Middle East, where anyway, people are looking more and more into fitness, and there is a huge rise in obesity anyway, and then eventually North America. But North America will be the hardest market to break. And then we want to try to sell it as quick as possible to the big guys, because really this is something that they can bring forward quite easily. So the idea is to have a quick exit strategy. And for the test of price point, yeah, the guys, the Just Beat consultancy guys that they are actually developing the app are helping us with identification of all the prices, because they've developed a very large number of extended applications. So they kind of help us to understand as where to put us in the market. So they take care of the price points.
Okay, great. Thank you very much. Grazie mille. Viviana, live from Italy. And last but not least, well, it's not last, I believe we have a couple of more startups to go, but so Global Group won't be able to make it. Fawzi Sulifat has excused himself. So we will dive. So by the way, before we close, do we have any other questions from our panel for Viviana, Dr. Viviana, Mike, Alexandre? Alexandre, you're muted. You're muted.
Yeah, no, I was saying no, it's pretty clear for me. I understand the concept.
Okay,
brilliant.
I would have the same just question. You are looking for a 250,000 against how many equity?
For 100, we get 25.1, and so make the calculation. We're happy to discuss this, but we're happy to give, it's quite cheap, the technology per se, but I don't want to say stuff. We should talk about this more in, yeah.
Okay.
Okay. Can we do a quick clap for Viviana? Thank you very much.
Yes, thank you.
Thank you, Viviana.
All right, and we see Christian here, so we're moving over to Christian Farioli.
Yes, great
right,
to be
you're
here,
very
guys.
smiley. Okay, you look happy to be here. We're happy that you're here too.
Another Italian guy.
Ah, okay.
Yes, there we are. I'm glad that I'm not the only one, like as usual.
Sure. How are you, Christian? Good?
Very good. I'm wonderful. Thank you so much. And I'm glad to be here with you guys.
And
Christian,
before we start, Munir, how much time do we have for Christian?
For Christian, we have 7 minutes.
Okay, awesome.
All right, that's a lot. Wow. All right, nice. Okay. Wonderful. So, Melcare, your connected healthcare assistant. Nowadays, hospitals, doctors, dentists, and healthcare providers are struggling to find patients because people are not getting to doctors for lack of time and corona, except in extreme cases. Marketing costs are also increasing, and I know that very well because I'm running my own digital agency and I have a lot of healthcare suppliers as a clients. Also, the healthcare cost is increasing for patients, and so the insurance premiums. When we look at how people know about healthcare, what platform people they use to fix themselves at the moment, the best healthcare providers are Google and social media. We know very well that when we feel pain before going to the doctor, we Google it, right? And that's what's actually happened. So much time that in UAE alone, 732,000 times a month, people are looking for doctors, pain, headache, or medicines instead of going to the doctor. And then when we look at worldwide figures, this number grow monstruously. We're looking at 161 million searches in Google alone monthly. So what is the solution? The solution is MedCare, your mobile doctor, ER, pharmacy, laboratory, specialist, nurse, insurance, and full medicine encyclopedia. Now, you are going to have your healthcare assistant powered by our health intelligence. So where you can ask information, you can ask information if you feel some pain, information about medicine, about doctors, about how you feel. It's like consulting your own doctor. But then when the problem gets serious, then you get connected directly to real doctors. We don't claim that we can fix the world on a mobile phone. But let's say that we can do most of the GP job on a mobile device. And users are so happy because they can do it anytime during the day. They don't need to leave the office at the typically peak hours and queuing to go to the hospital. They can simply go to the toilet or go in a private room and they can have a quick visit done. At the same time, sometimes they can even chat with a doctor, or they can chat directly or send a message and wait a reply. Or they can even visit the doctor in their own office timing, in their own clinic time. That's entirely up to the user to decide. So at the end of the day, the user is going to get the full medical history on the cloud, which means that even after a few months or a few years, if you still need to think, I've been to the doctor, what was the problem, what was the medicine, what was the solution, there's going to have a full medical history. And we know that typically we visit many doctors. So without a full proper medical history, a lot of doctors are taking mistakes simply because they don't know all of our medical history. They simply know the history that we spend with the same doctor. At the same time, if we require any prescription, the doctor can even allow us to go to any pharmacy and get the medicine, or even to get the medicine delivered to us. So we don't need to move from our chair. We can also use some of the credit that we have within the app, because in UAE, the users, they are mandatory, they are forced to have a health insurance. And then because of the health insurance, then who is paying is the insurance. But at the same time, we are gonna, with our app, give a little bit of cash back to the user itself. So the user is gonna have some little bit of credit that he can use in any other service that he like. The business model is simple. It's like the booking.com, because we are going to charge 10% of the total amount to the clinic. So, and out of this 10%, as I say, 2% go as cashback to the user. So it's a very easy, intuitive, thanks to our artificial intelligence. It helps clinics and doctors get patients, and it's totally free for users. That's why we built it around users, not as a marketing tool for clinics. And with the business, with the booking.com business model, it's very simple. We deliver a patient to a clinic and we get 10% as a referral charge. The financial opportunity, in our opinion, it's huge, because on a yearly basis, in UAE, $19 billion are spent by individuals, by residents and citizens in healthcare. That's a monstrous number. It's actually one of the countries with the highest per capita spend in the world. Out of this, we are charging 10% for the clinics. Basically, we are going to deliver patient to clinics, to any healthcare providers, even to pharmacies, etc., and we charge 10%. So $1.9 billion per year is our market cap in UAE. Now, if we get 3% of the market, we're looking at $57 million per year revenue. And this is only the revenue. Then we know very well that data is at the moment way more valuable than revenue itself. But this is a conversation that will happen maybe in a couple of years. So at the moment, we're going to need the funds to go from phase one, to finalize the phase one, basically to go from prototype to a working system, to sign more doctors and clinics and pharmacies and labs, and also get more waiting list patients to be ready to use our system. Then in the phase two, which is approximately in 1 year time, we're going to need to sign more doctors and pharmacy. And in this case, we're going to start already generating revenue. And in the phase 3, which is in around 2 years' time, then we're going to start working with the main hospital, integrate our system with the main hospital and main clinic systems, and start working and capitalizing on the data. How we are going to spend the money. So far, we got $100,000 from a Saudi seed investor. And this is how we reached the point up to now. We also registered the intellectual property for the brand, and we built the demo app. Now, we're going to need up to $1.2 million to basically achieve the full roadmap. But we can even start with $400,000. And the percentage is going to yearly list it. Typically, the sales team that we're going to require to sign all of the clinics and pharmacies, etc., it takes around 15%. The developing team at 25%, digital marketing, which is typically the highest cost, approximately 49%, 3% in legal, 8% in company and office. Those are pretty standard numbers. So why Melcare? Because it's an online medical consultation system. It's online ordering. It's include the insurance coverage. It's an AI doctor empowering, full medical.
Okay, I'm sorry, I've had to mute you because we reached 7 minutes, 10 seconds. Sorry, Christian.
Samar, we can maybe allow Christian to just finish off.
To finish?
Yes.
Okay, awesome. All right, so go ahead and finish up.
All right, thank you so much. I mean, we are a big team of people that they come from a lot of different background, all experts in their field. And just for in 1 month, we got out of a very small micro campaign, we already got on a waiting list 167 patients, 23 doctors, and 6 pharmacies. So we are confident that as soon as we get the investor funding us, then we are going to scale up very fast. Now, each user is worth for us $190 per year revenue. So the numbers are pretty easy. I don't like to brag about numbers, but it's pretty easy that with these numbers, it's easy to get a return of investment very, very, very fast in the biggest and fastest growing field. What are competitors? Obviously, there are some competitors, but all of them are focused in India. Their Indian company focus on Indian markets because they are not covered by insurance and the dynamic are completely different. Keep in mind that we are looking at $482 million already invested amongst the 4 main competitors. So the market is very mature now for healthcare services online. The beauty of Melcare is that we are focusing in UAE, where the economy of insurance has the highest per capita spend. It's comprehensive of doctor, pharmacy, lab, nurses, insurances, built around users, not clinics, charging clinics, not users. We even give bonus to our users. And then we're looking at as an exit strategy, even merge and acquisition with insurance companies or with even pharmaceutical or large healthcare groups, which there are many here in UAE. So we believe we have a winning project, a winning team, and it's going to be a winning investment for those that believe in us. Thank you so much. And for any information, you can have a chat with Munir, and then it will be a pleasure to meet you personally in Zoom or in person, also with my partner and the other co-founders.
Awesome. Thank you.
Thank you so much, Munir, for letting me finish.
You're more welcome.
Really
it was worthwhile since it's a great project. So it's worthwhile. The finishing line is really worthwhile. Let's turn back to the audience and see. Heike, I can see a big smile on your face. Heike, you have a remark for Christian?
Look, being based in UAE, I think it's absolutely amazing. I definitely would see a huge potential. You know, in my mind, obviously, I've worked also with and at large organizations, and it's always, and I hear, you know, the pain of so many people, and I just really can only underline that I definitely believe that is an amazing app, and you know, I even, you know, would be happy to help and support to make the network and at pro bono, you know, but help connect doctors and clinics and whatever, because I definitely believe is something which is it's needed and definitely has its purpose, and I believe in the success for sure.
Thank you so much, Heike. Definitely, really appreciate it. Definitely, we're gonna have a chat.
Alexandre?
Yes, please. Christian, I have one question, which is, I mean, I have 2 questions, but one is really related to the regulations. because I find it, your concept very interesting and very, very post-COVID and very futurist. But I mean, I don't know, for example, in UAE, but I can tell you that 2 countries that I'm very familiar of, even 3, Saudi Arabia, Bahrain, and France, my country, you don't make digital doctor consultations. You don't go to the pharmacy with a digital prescription. No way, it's not allowed. I mean, I know in Paris, I cannot go to the pharmacy to get my antibiotics and show an application, say, hey, my doctor prescribed this, give me it will be refused.
Yeah.
By the law, you must see a real doctor registered with real consultations, and he must give you a prescription, a hard copy on paper, and you cannot go to a pharmacy and present something digital.
Yeah, I mean, as said, it is in UAE, you can even go to the pharmacy and get a prescription without a prescription, but that's not a justification. The fact is that UAE is a country always looking at the future. And then even, I mean, I'm from your neighbor country, from Italy, that we are, I always believe that we are in Stone Age. But at the same time, one of my partners has been developing during COVID and for COVID a system to allow the digital consultation of doctors online. So again, I was having exactly the same idea as yourself. That's why one of my other partners is from Italy, and he also owns clinics and pharmacies. And he say, as soon as these things got approved, also we moved to Italy. And actually, it seems that even in Europe, because of COVID, technology is moving extremely fast compared to what it used to be, allowing routes that typically were not really the traditional way. Obviously, depending on the latest legislation, we're going to enable or we're going to prioritize some functionality faster than others. But the idea, basically, that's why we have a roadmap that we want to follow strictly, based obviously on the local regulation. But we know for sure that the healthcare authority, because I have many contacts working there, they all told me that every single person in Dubai Healthcare Authority are working to make sure that UAE government is the best of the best in the world in any field, in any aspects. That's why they are getting also a lot of medical tourism of patients visiting UAE for medical tourism, because there are more technology, there are innovation, etc. So for that, obviously we need the right partner, which is not only the person that's going to fund with money, possibly somebody with the right connection into the government to help opening up to as many functionality as possible without incurring in any legal trouble. That's for sure.
Okay, Heike, you had a question?
I just quickly want to say also in regards to the prescription. Today, when you get a prescription, you go to the pharmacy, and then the pharmacy, takes your prescription, and then online requests from your insurer it's going to be paid, and vice versa. You could do the same. If for example, if the doctors, like the prescription is coming to the app, and then, online, it could be approved by the doctor who has prescribed, and obviously he has to be registered before. So I think a lot is here already online without interfacing anything, so I definitely believe. Yeah. And in case you need contacts, I have PROs who can help you on getting the right authorities to.
Wonderful.
Yeah.
Thank you so much. Then doctors, at the moment, we have more than 8,000 doctors listed. And so it's our job, obviously, to make sure that the doctors allowed to be in our system are officially licensed by the UAE. We're not going to allow any person to claim to be a doctor, that's for sure.
But there is no doctor who is not licensed. So they're very...
Exactly. My question was not on the licensing of the doctors, was on the licensing on the process, because what you were saying about Italy, and there is, yes, some consultation online. Yes, we have the same in France through a website called Doctolib and whatever, But this is more that when you contact and you tell them, oh, I don't know, I burned my finger today, what I should do. So it's more like something commercial. But if it's going to be like something related to a big injury or a big cancer or something, no, it's not validated. Even the doctor is licensed and everything fine, but he cannot tell you online, digital through camera, okay, I'll see you have a burn at the 3rd degree, no problem, go to this hospital, they will treat you, just contact the insurance and I send you the prescription online. It cannot be. In Bahrain, the same, by the way. I'm very
right.
aware about this because I have 4 kids myself, you know, so every
Wow.
week there is one with an injury or with a sickness. So I'm familiar with Al Khobar and Riyadh Hospital and Bahrain. And it will help me if I could do this digital, you know.
Yes.
Injection, vaccination, we must be physically there, you know, we must be with a physical paper every time. So this is what my concept. UAE, I don't know the case of UAE, you know, but on the rest of the world, I mean, I wish we could do everything online, consultation and prescription, you know, it will solve a hell of things, you know.
I can say that one of the comments from Preti that say that the telemedicine is taking off in India right now. I know in many countries, I mean, I know that Europe is definitely the most bureaucratic country compared to
and
UAE.
And US, big time.
Of course,
to get antibiotic, it's even worse.
Yes, yeah. But by the fact that I'm here in Dubai now, almost 14 years, I've seen the country flying at the speed of light in any field. And I noticed that in healthcare as well, because many healthcare providers are already my clients as a digital agency. So I mean, I'm really confident that it's just about time. Until that's not going to be fixed, simple, we're going to have all of the visit, all of the consultation, even to get the over-the-counter medicine until it requires something more. So we can even arrange even people to go in physically and collect the physical paper from doctor. That's the last of the problem. Basically, we've been looking at this for more than 5 years. And we start moving now because until that time, it was not mature at all. It was way too early. But now there is enough confidence in even from the government side that this kind of activity are working already in India. That's why we're not the first. But that's why if we were the first, we would have needed so much money. And when we start asking 5 years ago, we were so pioneering this field that people had no clue about what we are talking about. Now, COVID speed up clearly the adaptation and the requirement of digital technology, even in healthcare. So that's why we're now ready to jump. And we hope to find in some great investor, somebody that want to jump with us.
Okay, and last question, how much equity you give against the financing?
For the equity, we need to have a separate discussion with my partner Corrado, because it depends on how much money. I mean, as I say, we can work from $400,000 to $1.2 million. We're not strictly to say it's like this or nothing. There are a lot of grays. It's not only black and white. That's why I say that for any conversation, we sit down with Munir and my partner Corrado, and then we have a very nice discussion.
Okay. Sure. Thank you.
Wonderful.
Sure.
Thank you so much, Alexander.
Christian, do take a look at the comments that have come in the chat as well. They're
Sure.
for you. I love the term phygital. Jean-Luc says the word is using phygital.
Yes.
It's not one or the other, they combine, and then Heike is agreeing and saying yes. As soon as it would be serious, then the advice would be to go to the clinic. So thank you.
I believe we have some remarks from Viviana Mucci, who is saying, Christian, this is very useful. My question are, can you share medical data, not just history, example, MRI scan, imaging, blood work, etc.? Is this used also for telemedicine and telerehab?
I mean, share medical data, it's a huge word that as we speak, your data belongs to yourself and nobody else. So only your doctor is allowed to see the data and that's it. That's why we can even give a temporary access. Let's say I'm going to visit a new doctor that he doesn't know me. Instead of wasting 1 hour filling up questionnaire, I give access to that specific doctor for that specific amount of time to my history data. So he's going to be able to see what I've done in the past. I got a fracture, I got an injury, I got something, and he can consider all of the proper past data. So that's going to be that. Then, of course, as I get an X-ray for myself and I show the X-ray to 1,000 people, or I post my X-ray on Facebook, in the same way, I can take my medical data, my lab analysis, and I can do whatever I want because it's my data. But as a company, we are obviously not going to share data with anyone or show off data with anyone. Actually, healthcare is quite strict in UAE, saying that even the data in the cloud, they should be maintained in a UAE cloud.
Yeah, no, probably I didn't express myself properly. I'm sorry. I meant once you mentioned about if a patient comes and you want to check his history. So you have like a cloud where you have all the objective measurements of the patients as well.
Of course.
Okay.
Of course. I mean, we know that in your phone, you have only the app that's going to show, that's going to take the data from the cloud.
Yeah, because that's already something that it's a little bit, already to have that in Europe will be already very, very good. Because
yes. Europe is also opening up to sharing medical information on the cloud, but in UAE, we know for sure that the cloud should be physically located in UAE, which is perfectly fine because both Etisalat and Do, they have a massive data centers based in UAE, so the privacy of the data to remain in UAE is not going to be a problem.
If I may say one more thing, so I used to work on a European project that was making a decision support system, and it never wanted to be commercialized because of the liability. So it was not even AI, it was just a support of the diagnosis for the patients. And we had so many problems with the liability because if the system makes a medical error, there must be always a doctor to check that the algorithm has not made the error, because then the liability is still of the doctor. So that was one of the big issues. But your idea, I really love it, and I found it very useful. If I can tell you one thing, what I would do, if I were you, I would focus on the type of care that no one focuses on. For example, everything that is chronic. Chronic, because everything that is urgent, you should not treat it, you have to go in person. But if you have chronic diseases, these patients have been visiting many, many doctors, and they've been having a long history, so they need to have a cloud where they store everything. And when they go for a consultation, they might have, I mean, chronic disorders are very difficult to be treated. So if you have something like that, then you can maybe be able to tackle a different market. So everything that is related, you know, chronic pain, fibromyalgia, like all these diseases.
Right.
Just suggestion.
Right, that's a great point. Thank you so much, Viviana. Definitely we'll keep into consideration. Thank you so much for the tip.
No problem.
Thank you very much, Christian. Can we do a round of applause for Christian as well?
Of course.
Thank you.
Thank you.
Bravissimo,
Thank you so
Christian.
much.
Bravissimo.
You're welcome. Thank you so much, my friend.
We have more remarks, but we will definitely keep in touch with you, Christian, offline for the supplementary remarks that we have on the chat section, and all the interest which we have received with Alexandre and for investors if they want to take the conversation further with you.
That's great.
Cool. Let's move on to Samar. We have, I believe, Vamsi Puta from Unitors, the EduTech. We would like to give some young blood a little chance to our forward, so we decided to make an exception.
To see you, Vamsi.
Yes, Vamsi, are you ready?
Thank you. Thank you,
Is it
Mari.
rude to
Yeah,
ask
I'm
your
ready.
age?
20.
Oh, wow. Mashallah. Okay, well,
Very
good to see you.
ambitious entrepreneur. The stage is yours, Vamsi. Lovely to see you.
Time-wise, Munir, is it again 7 minutes?
Yes.
Okay.
Yes.
All right.
Go ahead.
Are you
Yeah,
able
I'm sure.
to share your screen? Okay.
Yes.
Best of luck, Vamsi.
Thank you.
Okay.
Everyone able to see my screen?
Yeah.
Yes.
Hello, everyone. Welcome to Unitors for Students by Students. My name is Vamsi. I'm the CEO and founder of Unitors, and this is my team, very energetic and dynamic. We're all university students right now, and we have one graduate as well. So imagine not hating the idea of studying. Imagine being exam ready with just a click. Imagine a friend who can help you, learn better. So keep imagining on one day it's going to be a reality. The problem we're trying to solve is that for every single student in this world has these core problems that the tutoring is very expensive and the conventional education lacks innovation because it's always face-to-face and it's the same thing going on for decades. And number 3 is monotonous. There's no interaction because every student feels kind of kind of inwardsness. They don't ask many questions because they're afraid to ask, because the teachers are more aged, and the lack of convenience. When I say convenience, it can be timings, it can be the place of study, it can be even the tutor may not be good. And the solution is that whatever the problem is, we got the solution for that. So we're providing online training, very convenient and flexible according to the student availability. And we offer basket of fields, like you can learn anything literally, like dance, sports, music, dance. I know the idea is like right now everyone didn't get the idea. So what we're doing is that we're trying to connect school students with trainers in different fields. But the speciality is that our trainers are all university students, just like me. For me, I've been teaching school kids for the last 2 years. And it's been really working well. I've improved myself a lot, and now I'm able to manage my expenses and everything's going cool. So if this can happen to me, why can't this happen to every single university student in UAE? That's what the main motivation behind the idea. So it's like if a school student wants to learn something, and if he wants to go to a tutoring center or recruit a person who is well trained, he would have to pay more. But if he has to get trained by university students who have been learning, let's say, football for his whole 10 years, he would teach football for the school student for a cheaper price, and it will be much efficient for him, right? That's what the idea is. And so we don't you don't have to worry about the pricing, because we've got your back on that. We fixed the pricing. So we fix the pricing to 30 AED per hour. And also we provide part-time jobs, because that's the main motive. So market validation is that this was the mean of communication 150 years ago, and this is today. This was the mean of transportation 150 years ago, and this is the mean of transportation today. This is the education today, and this has been education 150 years ago. So we want to change it. We don't want to keep the same thing. So what we do for the market thing is that we collaborate with universities. We go to each and every university in UAE and make MOUs with them, so that we could actually work with the university to promote our startup. And that's how we're planning to expand. And the value generation is that we always try to keep the pricing fixed. So for us, the main competitors are things like YouTube, educational channels, Thinkers, and My Private Tutor. All these things, the only difference between them and us is that in their websites, all the tutors or trainers are from different, like they're already teachers, they're already professionals who are teaching in those websites. But in our website, it's only university students who are going to teach. So in that way, we provide opportunities to students. That's how we're different. So our market size by 2020 will be 20.8 million, because I've calculated that by the surveys we've conducted, we analyzed that there was 464,000 students in universities right now. So the worst case scenario, if we consider 10% out of it, it will be 46,400. And that many trainers we would be getting. That's the total market that we're targeting in the beginning. And if we consider at least a single student teaching single hour a day, this much money will be, we're getting 20.8 million per year. And this is our 6 months plan that we are planning. So by 5th of March, we'll be having 1,000 trainers and 500 students as our customer base and our stakeholders. So the target market is educational sector, obviously. And the traction is that we've already did a pilot project in the university, and we've got 25 customers signed already, and 192 university students who registered their interest to teach for money. And we've done because like a couple of friends, we've did this for the last 2 years, right? So this is how much income we've got, 60,000 in the pre-sales. So there is a market, and these are the testimonials that I've got from my students. So we have the app and website ready as well. So they can learn anything like softwares, dance, everything. So everything in one platform. So this is the website. We've created it from Wix.com. So both of them. It's up and working now. So more affordable, less age gap. So that's what makes us different and unique from others. Because imagine a situation, university student teaching a school student, the age gap is less. When the age gap is less, the school student would be more free towards the university student, and he would ask questions much effectively so that he could learn more and the classes would be more efficient. That's it. Thank you.
Thank you.
Thank you very much.
Thank you, Vamsi. I think Vamsi has respected exactly the
Absolutely.
the timing.
Absolutely. Yes. 6 minutes, 45 seconds, something like
And
that.
I have one review, if I can show. Like I've got some video reviews from my students. If I can show, can I?
Yeah, sure. Go ahead. Okay. And don't hesitate to mention how much money you're raising for your business as well. That wasn't there in the presentation. If you can mention it to the audience, it would be helpful.
I'm looking for 300,000 AED in the beginning.
Okay, 300,000 dirham.
Yes. So we're needing that because we need to create our own app and website, because right now we're under Wix.com. So we want it to be in our own platform. And also we want the money for marketing, which is around 50,000 as well.
Mm-hmm.
So that will be around 100,000 for the app and website and 50,000 for the marketing. And the rest of the 150,000 is for to support trainers with the products like iPad and many devices for them to teach.
Very well thought.
Getting the video.
At this stage, we can only see the presentation, the last slide of your presentation, Vamsi. Are you trying to switch into a YouTube video or something?
No, I'm sharing my screen. I'm just 1 minute.
Okay.
Okay, so if you want us to listen to the video, so then share screen, and then there's a little checkbox at the bottom which enables sound to be shared as well.
Yes,
yeah?
yes.
You probably knew that already. Okay.
Yes.
But that's a good tip to know, because we've seen a couple of startups struggling with displaying the video.
Okay, can you guys see my screen?
Yes.
Yes.
Hello, my name is Gabe.
Able to hear the voice?
Yes.
Yes.
When I first reached out to Chris, I was having problems in school. I didn't know what I was doing wrong and how I could reach my marks. I was having normal problems as most people would have. The attention that is given from this tutor is just focused on one person specifically, which would be me in this case. It's so much easier to concentrate, so much easier to learn things. You get things done so much faster, and it becomes so much easier for you to go through class. And I believe that after I started studying with Chris, my marks have been increasing so much better, and my extension span it's increased so much. And when I go to class, I believe that I have a head start to everybody else, because it just becomes so much easier, and I feel like I cover so much more stuff with him that I cover even in my normal class, and it's just so much better. I believe that it's so much more affordable than having tutors, because first of all, you pay so much more money, and the attention that is given to you is completely different. I used to be tutored by GLT, and my attention was, I had a class, it was basically a circle, and there was one teacher for 4 students, where when I book a lesson with Chris, it's just me and him, and we both concentrate on the same topic, and I get all his attention, and we get things done much faster because it's just me and him talking about everything. I feel more safe because it's just me and him, and I don't have to worry about what other students would think if I'm behind or anything, and everything goes so much faster. When I first got into tutoring with Chris, he already understood what my problems were, and it made it so much easier for me to pass through everything, because he already had an idea of what I wanted to learn and what I wanted to do, and he understood that because I was in the IB, I had to take a different approach than I was taking in class, because the books that we were studying from, they didn't actually cover the things that would pass in the test. They were mostly just simple things, just giving me the basics, and Chris took that into account, and he took his time to make his own my own worksheets and put the effort into helping me know everything better and to understand that I could understand and to give me the help in order to get the best grades that I needed. I would definitely recommend this for new students.
Yeah,
right.
That's it.
All right, thank you, Vamsi.
Thank you, Vamsi.
All right, questions?
Excellent, you want to start?
Yeah, okay, I have just one question. Does your application is your own or you're under a white label? It was not clear for me, I didn't understand.
So the application is under Wix.com right now. So when you download the application, it will be like a Wix application, but then when you go into the application, it will be Unitors.
Okay, so you're under a white label, right?
Yes.
Okay, no, clear enough, it was to understand. Okay. So the funds allocated to a potential investment will be primarily used to make your own application.
Yes.
Okay. And how much you value this cost?
$100,000.
To make an application?
Dirhams.
Dirhams, okay, yeah, okay.
Dirhams.
Well, it's more clear because $100,000 to make an application, I was, wow. Okay, no, clear enough. Okay, 100,000, which is 2025, yeah. Okay, clear enough.
Thank you, Alexandre. Anyone else? Samar, do we have Jean-Luc?
Yes, Jean-Luc.
Or
Yeah,
I guess ladies first.
I can
please,
wait.
Jean-Luc.
Yeah, I can wait. No problem. I can wait.
Heike, go ahead.
Sorry. I just quickly wanted to ask you, how would you ensure that the quality of the tutoring is the right one? Because being a good student doesn't make you naturally a good tutor. You know, and I have two teenager kids, and you know, they're both very, very good at school, but they have no patience to teach other students. So how would you make sure that how do you quality control, you know, or, you know, to check that actually the students who come to the lessons are improving at school?
So very good question. Thank you, Heik. So what we do is that before we recruit any trainer in the app, we have this recruiting process with the HR panel where they have 4 steps. The first step would be making an application with all their details, and then asking them to make a 1-minute video on why they want to teach, what they want to teach, and then a video on their experience and a documentation for their experience. If they if you want to teach math, what experience do you have in teaching math? Well, why would it make you a good tutor? So that, and we have a person like from the universities, from my university, who would evaluate all the documents with the video and also a call interview, and then only we would be that's how we make sure the quality. If it's dance, we have specific persons who evaluate the person in specifically dance. If it's sports, we have persons who evaluate the ability of the person in terms of sports. So in that way we make sure the quality. That's how we're doing it.
You know, my recommendation this would be that you do an assessment or like any sort of tests, you know, not only on their like skills, but also on their teaching. You know, you have like a multiple choice or whatever, some proper assessment, because video alone will not give you the requirements, you know. So I think you have to do like a deeper assessment and get it, see how to qualify.
Yeah, thank you for the suggestion.
Thank you very much. Jean-Luc, your turn now.
Yeah, I have a lot of questions, and I think this is probably one of the first times you pitch, or have you done that before?
I've done that before. A lot of.
All right, so
10 times, I guess.
I mean, a couple of tips I want to give you before the questions is in your pitch. A lot seems to be focused on making this cheap. And that is, for me, that's not, that's not a strong differentiation argument for a startup. So overall, I would recommend to flip that pitch a little bit, to talk more about the differentiation, and that leads me then to the question I have, two questions. One is really the differentiation part, because there's tons and tons and tons of tutoring apps. The ed tech industry is exploding. There's a lot of startups in that space. So if you want to attract investors, you also need to convince them that this is something that has potential to grow beyond your university and even beyond the country. So I wanted to hear a bit more about the differentiation, number one. And I think part of it was related to the onboarding of teachers and also the rating of teachers. But and the other thing, the other question I have is more about the revenue side. You mentioned that in the pilot you generate 60,000 dirhams from 25 tutors. Was that the revenue of the tutors, or was that the revenue of the platform?
Revenue of the platform.
Okay,
I will answer one by one. So firstly, the differentiation, from others is that, you see, the main difference in our website in UAE, there's no other company which is having trainers just from the university. If you take Sinkers, it's a tutoring app. If you want to learn math, and if you click math, it would show you people who are already professionals, like school teachers who are teaching math, everyone, literally everyone. But in our app, we only have trainers only from university. So every trainer that would be visible in the app would be from a university and would be studying university right now. So in that way, he would get a chance for sure, the university student.
Right. So and that is that represents a challenge, another challenge by itself, which means that you need to scale from university by university. This is also something to think about, right?
Exactly.
In terms of sales cost, in order to be able to scale that to more campuses.
Exactly. So what we're doing is we're first starting in UAE, and throughout like all the universities in UAE, then we move on to the other countries. So that's what I'm planning.
Okay.
And the second question was can you repeat second question? I'm sorry.
So I mean, the first one was on the differentiation. I still didn't hear. I mean, if you think that coaches or tutors from the campus is a strong differentiation, I'm not convinced by that. There is maybe your let's say the argument is that you have a stronger vetting for the tutors because they're vetted by by the university. So that potentially could be a differentiator.
Yeah, possibly. See, the main reason is that because it's only a university student, the age gap is less. When the age gap is less, the school student would be more free towards teaching, towards the teacher. He would ask more questions and he will understand more. That's what is the main difference. That's what the video review also says, right? So it's much easier for a student to learn from a person who is almost his age rather than learning from a person who is already like a professional or something. That's what I have experienced throughout the 2 years, and that's what my students say.
Yeah.
And the second question, sorry.
And I mean, it's a bit to the how you grow revenues. So one question is, so for instance, if you only focus on tutors from the campus for the students of the campus, how many people what's the percentage that typically would be interested in tutoring? And then also how you're able to grow that to other campuses.
Okay, so the trainers are only university students, as I said, but the students who are going to being taught, they can be anyone. They can be school student, they can be any student, like even a professional can be trained from the app. But the person who is teaching is only going to be a university student. I'm clear on that. So the revenue how we make is that we keep the pricing fixed from 30 AED to 50 AED, and when a person tutor charges a particular amount, we would get 5% out of it. That's how we make revenue.
Okay. Can I quickly just give a quick piece of feedback, Vamsi?
Sure.
Yeah, so
Sure.
and feel free, you can look me up on LinkedIn. I'm very happy to coach you on the side, okay, for your pitching and stuff. One of the things that I would have mentioned, which would have brought some clarity, is about how many hours of tutoring have already taken place through your platform, right? So
Yes.
then when you say 5% of every hour worth of, let's say 30 AED, immediately we can do the math and we know, okay, yes, this is how the $60,000 have been made, right? And obviously you're very young, but take a look at, all these fantastic pitch decks that are out there. So I think in terms of the design, you can improve. Yeah.
Thank you very much. I will.
All right. Yeah. Did we have any other questions? There are a lot of questions, by the way, in the chat that have come through, right? So Yvette is asking, when you
Yes.
mentioned market size, you mentioned university students, trainers, how have you validated demand from school students?
Okay.
The very last question.
Yes, I validated the
numbers
demand.
don't work out.
Yeah, I know. So when I say 25, it's the students. It's not the tutors who got registered. When I say 190, let me show. Okay, never mind. So 25 were the students, the school students, but the 195 is the number of students who want to teach for money, the university students. And the 60,000, when I said, that was the amount made by me. It's not the 5% actually, it's the whole amount. Because when I charge 3080, it's just gonna come to me, right, for now. So that's my revenue, not the 5% actually. But when I calculated the 5%, when I considered 10%, which is 46,400 students throughout UAE who wants to teach, that will be $2.8 million. That's how I've got that money. I mean, there's some lot of math calculation, yeah. And I validated demand because we've done a survey in the university, like internally, and we've known that like we've got 392 responses, and out of that, almost 190 people want to like teach for money. That's how I validated it. Yeah. Hope that answers.
Okay. Thank you. Thank you, Vamsi.
Samar, we have any more questions for Vamsi?
Not that I can see anybody else wanting to ask anything. Yeah, I think we're good. Okay, Vamsi, well done.
Thank you. Thank you for all the advices.
Thank you, Vamsi. We are expecting to have Ahmed from Synthetech, another health tech, but he's not responding at the moment. If you please let me know, Samar, if he's joining
He hasn't joined yet.
He hasn't joined yet, right? So he hasn't joined yet, as well as the other startups, such as Global Group is not here, has excused himself. Go Platform, same. That's it for the moment. So what we would do for the time being, what I would suggest is anyone from the panel of advisors, be it Hanan if she's around, Yvette if she's around, any one of you have some advices for our startups, how to improve their pitch or how to catch the attention of the investors, on how to work on their investment deck, on their business plan and the presentation. Yvette?
Yeah.
Or Jean-Luc, go ahead.
Okay, Jean-Luc.
Yeah, I mean, just starting with the last one, since that one is the one that is freshest in mind. I think when you present numbers, so that's a general tip for everybody. When you present numbers, make the numbers easy to understand for your audience. Make it easy to understand, what you get from one customer. And how you will acquire that customer, how much it costs you to acquire that customer. So make it easy to understand the numbers so that we don't have to do a lot of guesswork. So that is one thing I definitely would ask everybody to think about. The other thing is that sometimes when we think about differentiation, we tend to look only at the local competition. Some of you, like you know, Medcare was very clear on the global competition as well. Some others didn't take that global lens. So I think also about competition from a global perspective. So these are two of the main things, and try to skip also, let's say, stuff that is too generic that, you know, every kind of informed user would know about. So drill down straight to the problem, keep it short, make your numbers clear. Yeah, that's what I would suggest.
Okay, great advice from Jean-Luc Scherer, representing Innopolis. I would like to give the microphone to, is Mike Hardcastle, is he around or has he left?
Yes, he's here.
Mike, can you hear us, Mike?
Yeah, look, I'm just unmuted.
Okay, great. Mike, one of our prominent investors. Mike, could you please give some advice to all those, you know, those ambitious entrepreneurs which are with us today on how they would get the attention of someone like you? What would trigger your mind and say, okay, I want to invest in this person. He has, you know, what makes you?
Okay, I think I'm kind of listening in just to get an idea of the feel for it. But in the UK specifically, we have a public healthcare service called the NHS. So there is no, from my point of view, there is no commercial opportunities. The concept of commercializing anything, money just doesn't exist in the UK. Healthcare is free, you turn up, you get it. The only opportunities for commercialization is you can pay for a better room or you can pay for Wi-Fi or an ensuite bathroom. The concept of paying for medicine or doctors or to commercialize any of those activities just doesn't exist. So I was merely an observer on those pitches. Again, in EdTech, we do have fees now, but it's a very new thing for us. So again, education is mostly free. What I see in terms of the trends are really these open platforms. So YouTube, etc. Apple University, I don't know if that's still going. But again, that's not an area that I have a huge interest or isn't, again, not particularly relevant in the UK. So I don't have an awful lot to contribute at this stage because neither of those two sectors are relevant to the UK. They're not commercial activities. We live in a socialist democracy. Which I'm often pointed out from outside the UK. So yeah, I'm quite interested in travel tech, which I guess is coming up.
Yes.
Because obviously with coronavirus, that's really turning the travel industry upside down. And I'm involved with a couple of travel tech companies that are massively pivoting at this stage. So I'm very interested in pivoting for travel tech. I guess the only thing with EdTech is in the UK, I guess most of the world, universities are struggling to get back to normality, you know, lectures and et cetera, et cetera. I think there's a huge opportunity for virtualizing universities. So don't just focus it on sort of extra tuition or something like that. Is maybe physical universities will disappear as physical offices are disappearing now. Maybe the bricks and mortar universities will disappear. We have a very famous university in the UK called the Open University, which was started by the British Broadcasting Corporation or BBC, and it started off life purely on TV. So you could watch lectures on TV back in the 60s and 70s. That's morphed now onto the internet. But that set a model for virtual universities back in the 60s and 70s. And I think we really need to catch up and understand where the technology is taking us. And so I think EdTech has right now has a massive opportunity to take advantage of what's happening in the world.
Excellent.
That's pretty much it.
Great input. Thank you very much, Mike. We are very glad to have Dr. Dalal Rawes in our audience, right, Samar? Can we give the mic to our female investor, Dalal Rawes, representing, I think, Big Ventures?
Dalal, if you're there, you can just unmute yourself. Okay.
Dr.
Are you
Dalal,
there?
can you hear us? I believe
I
she's
sent
not.
a request to unmute. Maybe she's gotten busy.
All right, so no worries. We can switch to Saleh Abbas, representing Flat 6 Labs in Bahrain, the accelerator, one of the most prominent accelerator in Bahrain, and our guest of honor. Hi, Saleh, can you hear us?
Hi, everyone. It's nice to be with you. And thanks for putting this together, Munir. I'll just turn my camera on for.
Sure, you're very welcome. Thanks for your presence. Yeah, same.
Yes. Yeah, I guess for everyone that's not familiar with Flat 6 Labs, we're the largest early stage venture capital company and accelerator network in the Middle East and North Africa. We're currently located in Cairo, Bahrain, Beirut. We've got a fintech program we've just launched recently in Saudi and Riyadh. We're also set up in Tunisia and we're launching in Jordan next year as well. And Bahrain's a little bit different. The division that I run is international and local startups. The rest of we all have independent funds. So in that sense, we kind of operate in silos. But with Bahrain, we're a bit different because the rest, they only focus on the local startup ecosystem. And us, we focus on local and international, mainly because we're a lot more strategically located to, scale into the GCC and into the Saudi market, which is just about 30-minute drive from Bahrain. And so, yeah, in Bahrain, we've in the past 2 years done over 44 startups that we've invested in so far. And in the region, to date, we've done over 280 startups that we've invested in so far. Yeah, any questions that anybody has or anything?
Yeah, so what are the advices that you can give to our ambitious startups on how to increase their chances of getting funding and attentions?
Yeah, I'd say one thing. I think Jean-Luc was discussing this earlier was, and this is something that I've come across a lot. It happens quite a bit over here in the MENA region, but I've seen it also happen in Europe as well when I've been over there, where you have early stage startups that are not aware of their competitors, and it really becomes like a huge red flag because you feel like this person has sometimes put in 6 months to a year of work into the startup, and they haven't put even 4 hours of proper research into scouring just the internet, pretty much finding out if there's anybody else out there doing the same thing. And whenever we see that, it usually kind of indicates to us that this probably isn't like, it gives you a sign of incompetence kind of on the founder's behalf. And also the idea that, this person is going to be doing this in similar strategies for many things when it comes to probably how they think of how they're going to build the product, how they're going to market the product, instead of going out there and doing their research and being able to sort of, start from a good established state that already exists. They're trying to sort of reinvent the wheel a lot of the times, and there's just no necessity for it. And I've seen that here quite a bit, and I've seen it. I've even seen it vice versa when I was over at Web Summit in Portugal, where I met this company that thought they were the only guys doing what they're doing, and it's basically just a QR queuing application for to help shorten lines in banks and insurance companies and things like that. And ironically, like they still hadn't even started to scale, whereas in Bahrain we had a company that had already scaled across the whole GCC and had signed with the biggest network banks and everything, and had already been incorporated past series, and they were past Series A. So I'd say that's one of the main things, is to really understand your market and understand the competitors when it comes directly to your product as well, and also to be realistic when it comes to your asks. There's so many times that we meet people where we don't even bother to continue with the negotiation, because what happens is that they'll come and tell you that they're pre-MVP, they haven't gone out into the market, they have no traction, they have no revenue and no historical data to base their forecasts on for the next 3 years. But they'll basically come to you and say like, oh, we value ourselves as a $3 million company, based on the idea that there's like another well-established company out in the market that's already scaled, probably at Series B or something, and now they're valued at 120 million. And that really doesn't mean anything at all to us. You know, like I could meet thousands of people who could come across and say, like, you know, we've got this idea, this is the team, and we think this is our valuation, but you haven't actually proven that you've got product market fit yet, and you haven't proven that you guys actually understand how to even scale the product, right? So be really realistic and humble when it comes to your conversations with investors on like where you think your valuation lies at, and what the ask is, and don't always focus just on the financial investment, right? Like focus on the fact that, you know, if this is a proper VC or even an accelerator, that if they're well established and they're going to be a strong strategic partner, you need to really take that into the equation, that they're going to take their time out with you, a startup who at that point usually is starting at scratch, and you know, they're taking a big gamble on you, and at the same time they're coming in very well established with like a large network and a track record. So you should always take all those things into play when you're if you do get to the point where you're in those conversations of negotiating your very first investment, you know, your pre-seed stage investment. And that's pretty much, I'll say just off the top of my head, that's pretty much the main notes, I'll say.
Yeah.
Wow, great insights. Yeah, John, you want to add something?
Yeah, that's you made me think about one thing now that I think a lot of startups forget, and that is to take the seat of the investor when they do an ask.
Yeah.
So if you think about you know, an angel investor, venture capital, they gain what they expect is the valuation of the company to increase over a certain period of time. So in a sense, when you present your ask, you need to present the things you will do concretely that will help you know, prove to the investor that you're going in the right direction. So for instance, if you're asking me for money over the next 12 months just to do development, the valuation of the company will not have increased over that time, because, you know, there's no data that will basically substantially help increase the value. So it's always important to think about not only about the ask, the money you want and the equity, but also what is it you aim to achieve to basically help the valuation to increase over the period of time. I think that's an important thing to keep in mind as well.
Thank you, Jean-Luc. And
if I may add something,
yes,
you know, myself to have practiced 2 startup companies with Flat 6 Lab and with Saleh, I highly recommend the startup to participate in their bootcamp, because the bootcamp they do regarding the investment they are going to do is really well structured and very helpful.
Thanks, Alex.
Thank you. And probably we have one more investor with us who joined recently, I think Raghavendra Manbo. Hi, Raghavendra. It's a pleasure having you joining us. Can you hear us? Can you unmute your microphone if you're among us? Raghavendra?
Yes,
thank you, Munir. Thank you for inviting.
Yeah, it's a pleasure.
It was very interesting to listen.
Yes.
Sorry, are you able to hear me?
Yes, we can hear you. Yes, definitely.
Sorry, I'm on a phone right now, so I can't turn on my video. Sorry about that. Hopefully next time I'll video.
Sure.
But it was quite interesting to hear the startup making the pitch. What I would have liked to see is a little bit more detail on the ROI for the investors in the startup. You know, most of them presented the data, their ideas, what they want to do, but really there was no, as other panelists mentioned, there was no backup data to see how it is going to scale. So from my point of view, I would like to see that more if I were to invest in any one of those things.
Sure.
There were 1 or 2 great ideas. 1 or 2 needed a little bit of improvement in their pitching. But yes, all in all, a good session for me to understand. Thank you.
And thank you, Raghavendra. And we'd love to see you back tomorrow. We'll have some more exciting sessions on fintech, pure tech, and insurtech tomorrow, Tuesday, 6th of October. Before we close the session, Raghavendra, I have a question for you. So most of the startup, like we think that they don't have like, they need to be more down to earth on when it comes to the investment, the cash on the table. Can you just explain in a few words how long it might take for the startups to land the investment they're looking for? Is it like we're talking about weeks, months, depending on the idea?
Well, there is no hard rule on that. If somebody has a data to back up, and if they have done their research completely and their idea is outstanding, it can completely move faster. The investors can quickly move in within a weeks. But for example, a couple of investors really did have very basic things were not covered here. They're still trying to struggle to pitch. For that, I think they would need 2 more, 3 more sessions with some of the mentors. They should try to, build up their investor deck in a much more attractive way. And you are allocating 7 minutes or 8 minutes, and each minute matters for them. And each minute matters for every investor here to see what is that they are going to get out of it. That's what I think.
Sure, excellent. Thank you very much, Raghavendra Manbol. Back to you, Samar. I believe it's the time now to close the session, since the 2 startups which we were expecting have excused themselves, so they will be pitching on some other days.
So thank you very much. I think we start off with thanks. Oh, Heike wants to say something. Yes, Heike.
Yes, Heike.
Sorry, apologies. I just was wondering, in preparation, because obviously you have some runs with them, would it not be advisable just to give them a basic layout, what is actually best practice to help them to, like rightly said, not to waste our times and their times, rather than give them guidelines, said, look, like the best practice in giving a pitch, and this is what people want to see, and give them like a limited format, but with all the information which are relevant, they have to address to, because this will give them more guidance, and it makes it also more structure and more clear to understand. Yes, we don't want to lose their identity. However, if we just can give them a basic framework, I think would be, in my point of view, a very good idea.
Yeah, very good point, Heike. We actually do provide a template to every startup who is coming to pitch, with some guidance, with some startup guidelines, the do's and the don'ts. So every single startup have that once they onboard the BizzMatcher Accelerator conference. So it's really, up to every startup to follow the guidelines. And once they follow, we make sure they follow the guidelines. Unfortunately, we can't, we have we also do rehearsals, technical calls to make sure those aspects are covered. But for the sake of time, some of the startups unfortunately don't make it on time, and then they end up pitching as of today with their own versions, which we haven't validated before. So that those kind of loopholes do happen. But we do provide them from the very start guidelines, and even a pitch template with the problem, the solution, the ask, the breakdown of the money, how they're going to spend it, what is the revenue, the business model, and we can have a look into that. We're happy to share with you the template that we share to the startups, so you can have a look and you can give us your feedback.
No, if you want, like for example, because I'm just an advisor, I'm not an investor, but if you would share, for example, prior some of the pitches, we can just do like a pure rehearsal and then say, look, this is not included. It's not, if your time would not allow it, you could ask maybe some of the advisors to do so. I'm more than happy to do it, and then, it saves time. But yeah, we can take this offline, sorry.
Sure, absolutely. Happy to do that. Thank you for your comment, Heike. So Samar, back to you.
Yes, all right. So I was going to start off by saying thank you to all of the startups for actually, doing the hard work, preparing their pitches, working on their ideas. Obviously, for some of them, we've already summed up pretty nicely that, look, you do need to do more research, find the right product market fit. I think there were some questions that came up from the judges around that. I've written in the chat as well that, yes, return on investment is very important. What are you planning on doing with that money? So 4 things, right? So 1, how much money do you need? What do you need it for? How are you going to make sure that, what is the return on investment based on that money? And number 4, how soon can we start seeing those returns coming back to facilitate the investors? So kind of like, what's the timeline? So I think that's important. one of the things which because I'm sorry, Munir, I'm just going to take a quick second, right? So I'm putting on my mentoring hat.
It's okay, and we are so we're so happy to have you, since you're not, Samar is not only a moderator, but Samar is an angel investor, which makes it even, you know, more impactful for our audience. So thank you very much, Samar, for your insights. Please go ahead.
So you know, so the good news is that with angel investors, of course, they are more patient. They're ready to give you more time to actually grow your business and start showing the return on investment, but they still want to know, is it going to take 2 years or 4 years or 3 years? And especially on the impact side, sometimes it takes longer, but that obviously does come up. Your business model needs to be very, very strong. So we saw some questions around the business model as well. I felt that the startups missed a story, right? So storytelling, absolutely. So a lot of the startups just went into, okay, this is a problem, this is what I'm trying to do, excellent, my team is great, everything is great, but there is no, that hook is missing, right? And today we had few startups, but imagine that there were 20 startups. How will you make an impact or leave people behind with your story? Because at the end of the day, people remember stories, they remember anecdotes, they remember that passion and that sincerity that needs to come out, right? And that I felt was kind of on the weaker side, right? So anyway, so that was kind of how I would sum it up. I think when you have 7 minutes, that is an awful lot of time. So again, I would urge everybody to practice the 4-minute pitch, the 3-minute pitch, the 30-second pitch, the 1-minute pitch.
The elevator pitch.
Yes, absolutely. And that will help you eliminate all of the fluff, the extra stuff that you don't need to say. Sometimes saying less is going to be a lot more. For the video, for instance, if you're going to include videos, they have to be short and perky, they have to be interesting. The person that you're selecting to do your testimonial has to be engaging as well, right? So I think all of this is feedback. Everything is available. You can go ahead and do it. Pitch, practice, breathe. I don't think we had that problem, by the way. So people did respect time overall. So yeah, so that would be my feedback as well. And thank you very much once again. We do have this running for 3 more days. So we look forward to having some of the people back. People have messaged separately in the chat saying they'll be back tomorrow. So looking forward to seeing you guys again and happy to assist.
Yes,
thank you, Monique, for having
yes, indeed. Well, it's a pleasure, Samara, and we really hope we will have each and every one of you tomorrow, because we're going to be having an even more exciting session about fintech, intratech, and pure tech. For tomorrow from 3 p.m. until 6 p.m. normally. And for all the startups, some of the startups who have joined now will be pitching tomorrow. So please be mindful that there is a technical call at 2 p.m. to make sure we cover those technical aspects and that your pitch deck is actually in compliance with our template, as mentioned by Heike. So make it on time and you'll be successful. All right. So thank you again to all the our advisors and investors who have joined day one today, and we look forward to see you tomorrow for more.
Sure. Thank you. Thank you very much.
Thank you.
Thank you. Bye all. Bye. Bye.
Bye.